Hi, welcome to Pharmacology by Lecturio. We're going to continue our journey talking about the autonomic nervous system and the drugs that we use to control it. My name is Dr. Praveen Shukla. We're going to talk today about some of the drugs that are mimicking the sympathetic nervous system. Let's take a look at sympathomimetics. We have direct activators and indirect activators that imitate the effects of excess adrenaline on the human body. Let's first talk about alpha agonists. Now, the classical drug of alpha agonist category is norepinephrine. It is a non-selective agent. Alpha-1 selective agent is phenylephrine, and an alpha-2 selective agent is clonidine. It is important that you memorize these drugs. They are going to be on your exam, and they're going to be prototypical drugs. We won't talk about other alpha-1 and alpha-2 selective drugs. We'll just focus on these ones. What about beta agonists? The classical or prototypical beta agonist is epinephrine, which is an endogenously produced amine. The non-selective agents are epinephrine and isoproterenol. The beta-1 selective agonist is dobutamine, and the beta-2 selective agonist is albuterol and salbutamol. Salbutamol is more commonly known as Ventolin, and these are inhaled drugs. Remember that beta-2 means you have two lungs. These are drugs that are active in the lungs. They're generally inhaled medications. In terms of the indirect activators, there's release of adrenaline from the terminal nerve buton, and that's caused by amphetamines. And there are reuptake inhibitors. Drugs like cocaine and tricyclic antidepressants work through that mechanism. The indirect activators also include dopamine. Now, dopamine at low dose activates dopamine receptors. At intermediate dose activates beta receptors, and at very high doses activates alpha receptors. I'm going to tell you a little story about dopamine so that you remember. If you remember, I gave you a picture of the terminal nerve buton of both the cholinergic and the adrenergic nerve. Let's take a look in more detail at the production of norepinephrine in the adrenergic terminal nerve buton. We start with tyrosine. Tyrosine is converted by a hydrolase into DOPA, and DOPA is converted into dopamine. Now, dopamine also undergoes a chemical reaction, and during that chemical reaction, it is also packaged into vesicles. The chemical reaction converts it into norepinephrine, and that norepinephrine is stored in these vesicles or bags of enzyme. The norepinephrine vesicle is kept at the end of the terminal nerve buton until it's needed. And when there's a signal from the nerve, that signal is usually calcium. The norepinephrine is released into the synaptic cleft. Now, you need calcium in order for that synaptic cleft, for the vesicle to bind with the membrane and release into the synaptic cleft. Okay, so now your norepinephrine is in the synaptic cleft. There's one of three things that can happen to norepinephrine now. It'll either be diffused away or metabolized and therefore made inactive, or it'll activate the adrenal receptor itself and cause an effect, or it'll get reuptaken. So reuptake is usually mediated through the norepinephrine transport molecule, and you can see it there, it just appeared. Now, we do have inhibitors of that NET molecule. That's tricyclic antidepressants and cocaine. So cocaine inhibits the transport molecule, leaving more epinephrine in the synaptic cleft, and that's how you get the hyperadrenergic response with cocaine. Now, incidentally, in the brain, tricyclic antidepressants do have this effect as well, and that's why you have a reduction in depression in some cases.